And we're joined now by Sam Cooper, the past president of AMCHP. Sam, good morning.
Hey, good morning, Jennifer.
So how does it feel? You're kind of on the flip side, coming back as past president.
Oh, it's amazing. I think that for the last few years, being such having a chance to be such a connected part of the board and the association, it's really kind of thrilling to kind of see all of the work that's been happening and all of the excitement that's going on at the conference today and this week.
Talk to me a little bit about your term. What were some of the challenges? What were some of the accomplishments?
I think the greatest accomplishment, and it was work that was done through not only our members, of course, but staff with the association, our board, is about developing a new strategic plan. So we have, and we're sharing that this session, this conference, you'll have opportunities probably many times to hear about the new vision, the mission, the strategic plan that includes goals about really investing in maternal and child health and how AMCHP can be a great resource for our members.
Well, that feeds right into looking into the future.
Yes.
What do you see for maternal and child health as we're looking ahead?
Well, I think obviously probably what may be on many people's minds now is the issue with Zika virus. And so Title V really has a unique role to play in the public health world in ensuring connections not only for looking at maternal health issues, but also for children and youth with special health care needs, for those children who may be born with microcephaly. It's a good opportunity for us to make sure that we're connecting with the other partners within public health. So CDC and HRSA and SAMHSA all working together from the federal side, but then our states actually taking that connection-making ability and actually applying it to the systems within our own agencies, within our states back home.
It seems almost like a scary thing. You wake up one morning and there's a new crisis.
And that flexibility that Title V has been built around is something that's an asset for this country. And I think that that's where focusing on how to use those resources in ways that are unanticipated needs is really kind of what we do. That's the business that we're in. And so, AMCHP is just a great organization that helps support states and really helps us all understand and learn from each other, but being prepared to be that flexible and be able to take on those issues.
So you've got tons of sessions going on, so many people. What would you hope they take away from this year's conference?
Well, I think there's a couple of things. I think AMCHP has many opportunities for volunteers, and I think that we'll have our business meeting on Saturday morning, so I hope that you'll get up bright and early and come join us for that. But I think there's always an opportunity for you to invest in different ways within this organization. And I think that first, take some time when you get home, because 3 or 4 or 5 days for some of our participants, it takes a lot of energy. So take time when you get home to kind of breathe, let it soak in. Next week, pull out some of that material and go, I think I may need to call that guy in Tennessee who knows something about X. That's a critical thing that I think we can benefit from this kind of a conference, learning from each other and supporting each other through some really interesting, challenging times.
They are, and just because you're past president doesn't mean you have gone off into the sunset, correct?
That is correct, that is correct. So I intend to be working towards improving maternal and child health across this country and in our state as long as I can.
Well, thank you so much for joining us. It's been a pleasure.
You bet. Thank you, Jennifer. Appreciate it.
Take care.